This week marks 5 years since the fertility tank disaster at University Hospital's Ahuja Medical Center. The tank meltdown destroyed more than 4,000 eggs and embryos, impacting nearly 1,000 patients.
Senior health correspondent Monica Robbins broke this story 5 years ago and takes a look at what has changed since.
Lab workers were just days away from moving the eggs and embryos into a spare tank for safety so they could fix the malfunctioning one. On March 3rd, after staff leaves, the tank temperature begins to rise. A remote alarm designed to alert the embryologist on call was deactivated. When staff returned March 4th, they heard the inside alarm, but by then the damage was done. On March 6th, UH begins sending letters informing patients. University Hospitals apologizes, offers free counseling. UH self-reports to federal regulators. March 12th, the first of dozens of lawsuits are filed against the hospital. March 26th, UH sends a new letter to patients, revealing the entire tank was compromised. A total of 4,000 eggs and embryos with 950 patients impacted. April 20th, UH CEO Tom Zenti sends a memo to hospital employees outlining all of the changes that have been made to the fertility clinic. May 1st, the Centers for Medicare and Medicaid Services issues a scathing 9-page report detailing their investigation into the failure. The hospital lost its accreditation with CMS over the failure, but regained it after it reported changes made to protocol and the lab. Those changes included installing a remote alarm system which would notify 5 people instead of 1, implementing a new policy and procedure plan to perform checks and preventative maintenance. UH declined to take part in an on-camera interview or show me the updated implemented changes, but did release a statement saying, quote, "Over the past 5 years, university hospitals sought to serve those patients impacted by the 2018 event. To that end, we successfully resolved all claims and successfully worked with hundreds of patients to provide fertility services. Equally important, UH implemented a number of safety steps to prevent a similar incident in the future." Now, the fertility disaster had a ripple effect across the IVF industry globally. Many centers revisited and revamped their protocols to prevent similar disasters. As for the lawsuits, UH claims they are all settled, and those involved have signed non-disclosure agreements, preventing them from discussing how much the hospital paid them.
When we look at the situation globally, do these things still happen?
Not necessarily. We haven't seen anything with the cryo tanks, but we have seen mistakes are still happening. In fact, there were a couple of cases in the last couple of weeks, but they're different. They're a little more high-tech issues that are happening. And also, you know, a lot of experts are saying that this industry needs to be more federally regulated. And there was a bill presented in the House of Representatives back in 2021, but it never got out of this health subcommittee.
Wow. I mean, your heart breaks for these parents who are banking on this.
Yeah.
But it's good to know that protocols are in place and it's happening less frequently. Thank you, Monica.
Yes, thank you.